We're here today because as a dental professionals, we have an incredible opportunity right now, and we have a responsibility to work together to advocate for change in our industry. We love what we do. We care about our patients, and we want to provide them with the best care possible. But as many as you know, that can sometimes feel like an uphill battle against dental insurance companies, their unfair policies, and a system that isn't always designed with the patient care in mind. Rob and I have been in the trenches of dentistry for years. At one time, we looked at each other and realized that we can do more, and we have to do more. I still remember a particular day when we were reviewing some of the billing policies, and it struck us just how much control these third-party payers have over what we need to charge for services that we provide with our own hands. It was frustrating to see the least. We had a patient who needed a specific procedure, one that we knew was medically necessary, but because of arbitrary downcoding, insurance decided to reimburse for a lesser procedure, leaving us and the patient to pick up the pieces after everything was completed. It wasn't just about the money, it was about the principle. There was a moment at that moment that we really decided that we needed to act. That's when we began to work and help our dental colleagues not just navigate these challenges, but respectfully fight back. And that's what led us to House Bill 359, which is now known as the Network Leasing, Downcoding, and Bundling Protections Law. This law, which was written and passed in 2020, became effective in 2021, was a major win for Utah dentists, most importantly for our patients. It put a stop to some of the most frustrating and unfair insurance practices that plagued our industry for years, and the impact didn't stop in Utah. Tennessee just saw that what we accomplished and adopted the bundling verbiage from our law last year, word for word. Other states are now actively working on implementing similar legislation. And as a side note, we just met with somebody from Arizona who's interested in passing that law as well. And that's the power of advocacy. That's the power of working together. Now we need to talk about some of the real challenges that we're facing today. One of the biggest issues is insurance companies dictating what we can and cannot charge for services they don't even pay for, regardless of current non-covered and bundling laws. Imagine a patient needing a specific treatment that their plan doesn't cover. You offer them the best care possible, and they are willing to pay for it. But then the insurance steps in and says, even though we're not paying for it, you still have to follow our fee schedule, or worse, not charge for this thing at all. It's like a guest, right? Going to the restaurant and trying to dictate the fee for a dinner menu or an item on the dinner menu that they're not even eating. It doesn't make any sense. Or take automatic recoupments. This is when the insurers decide months after service is performed that they overpaid you and they want their money back without clear explanation. And what's worse, they take over payment from a different patient on a completely different claim. It's like your boss deciding years later that they overpaid you for one paycheck, and instead of asking you to resolve it, they quietly deduct that amount from a different employee's paycheck and tell you to figure it out. Not only does this create an accounting nightmare for our practice, but it's also a clear violation of patient trust and even HIPAA regulations. It's unacceptable, and we've hopefully put an end to this with House Bill 495. We are incredibly grateful for our support with the UDA and for those leaders who recognize and support the thought leadership that drives our advocacy movement here at My Practice, My Business. The work that we did on House Bill 359 was just the beginning. Together, we've shown that when we stand united and with organized dentistry, meaning our UDA, we can create real lasting change, and we are not done yet. Right now, we're focused on House Bill 495, which is on your table, and I've stapled that for you to review. The additions to this bill are all underlined for you to review. Some key components. Number one, prohibiting third-party payers from forcing write-offs for services rendered. Because if we perform a service, we should be paid for that service. It's very simple. Ending automatic recoupments for overpayments. Dentists should not be at the mercy of accounting errors by dental insurance companies and their unrealistic tactics to claw back payments at their discretion. Now, as a side note with this one, with the new law, the insurance companies will be required to give us notice for 60 days that they would like a refund back. If after the 60 days we've not issued a check back to them, then they will have the ability to automatically recoup that payment back. Mistakes are made, we don't like it, but again, we want to play fair with this. Adding dentists to the list of dispensing practitioners. We're grateful for Val for raising awareness that dentists were removed from dispensing practitioners in the state law in 2023. So we would like to add dentists to this dispensing practitioners list, and this will allow us to provide prescription mouth rinse, toothpaste, and fluoride directly to our patients. We diagnose the need, and we should be able to dispense the solution until the patient can get to a pharmacy. The last one that I wanted to emphasize was stopping automatic re-enrollment into the virtual credit cards after we opt out, because no should mean no and not try again later. Each of these provisions represents a major step forward with our profession. They're the kinds of changes that allow us to focus on what really matters, treating our patients with the care and the respect that they deserve without the constant interference of unfair dental insurance policies. And I do, again, want to express my deepest gratitude to, number one, our MPMB clients that are around here, the UDA, and Representative Jim Dunnigan, who unfortunately I don't see him. He's around here somewhere in his meetings. Honestly, all of your support for my practice, my business, has made this work possible. You've given us the ability to fight for these legislative changes that protect dentistry and those we serve. And it's your continued support that allow us to keep pushing forward and making sure dentistry is driven by those who truly understand it, dentists and their teams. Lastly, change doesn't happen in a vacuum. It happens when passionate, dedicated professionals come together with shared vision and refuse to accept the status quo. We've already made incredible strides together, and together we can continue to shape the future of dentistry. And I thank you all for being here. This is my first lobby day, and so it's really fun to see how everything happens. And thank you for all of you for helping us stand with this fight. We need to keep continue making a difference. One bill, one policy, and one patient at a time. Thank you.